In our news tonight, September is Gynecological Cancer Awareness Month. And before the month comes to an end, 13's Michaela Kelly is here tonight. And she spoke with a cervical cancer survivor who is sharing her journey to remind others to stay on top of their health.
Yes, David, at 61 years old, Amy Rose Herrick heard the daunting words nobody ever wants to hear. You have cancer. Herrick conducted an immense amount of research seeking out her best options for treatment. A path that led her back home to the capital city.
There's an end goal. My end goal was I wanted to live, and I wanted to live a full life.
Although Herrick had lived in Topeka most of her life, she and her family had been living in the U.S. Virgin Islands for about 13 years at the time of her diagnosis. She then discovered one of the top 50 cancer centers in the nation was located at the University of Kansas St. Francis campus.
I grew up in Topeka, so it is a true privilege to be able to come back here.
Herrick decided the breakthrough high-dose rate brachytherapy was her best bet at beating the cancer. The technique allows for highly targeted radiation therapy that minimizes damage to surrounding healthy tissue.
I had some concerns about the actual procedure, but when I voiced those, and then they showed me and walked me through, those evaporated, and it was really about a stress-free experience than what you would have normally expected.
Dr. Jay Xiao guided Herrick through the process, bringing plenty of insight as one of the doctors who helped create the program at St. Francis.
The idea for building this program is creating this standard of care option that is more local to the community here so they don't have to travel elsewhere to get this treatment.
1 year in remission, Herrick is surviving and thriving.
In one way, it was a gift that the cancer diagnosis gave me because I stepped back from everything else. It depends on how you choose to look at it.
And Dr. Xiao is glad to see it.
You get to follow these patients for the rest of their life. That's part of the reason why I went into radiation oncology and part of the reason I love to do what I do.
Herrick's mission now is to remind both men and women to keep up on screenings to catch a disease that can sneak up on anybody.
Why wait? That will cost you your life versus going in once a year and getting checked and saving your life.
The University of Kansas Health System recommends that women should see a gynecologist for a wellness visit once a year and get a pap test every 3 years, more frequently if abnormalities pop up or there is family history. Victoria.